Hey, if you've been wondering if testosterone replacement therapy is for you, this is the webinar you should watch. This is the first part of a three-part series where I'm going to cover the benefits of testosterone, how to treat it, how I've been able to help men and women in my practice for the last 11 years with replacement therapy, what are some of the side effects, benefits, and risks. But I'm also going to teach you which labs you should be ordering and how to get those labs ordered. Stay tuned for a great set of webinars. As usual, there's a great Q&A, and let's roll. Hello, again, this is Dr. Patel. Welcome to another webinar. This topic is exciting for me. It's about testosterone therapy and testosterone deficiency in men. In fact, this is how I got into the kind of medicine I do, which is wellness-based medicine. Over the last 11 years, I've been able to help men and women who are struggling with their health. And one of the areas that's undertreated in traditional medicine is around hormone replacement therapy and hormone balance. Today I'm going to focus on male testosterone, but the symptoms and issues are similar for women. So welcome to the webinar. Again, this is Dr. Bhavesh Patel, and we're talking about low T. Now, low T centers have been around over the last 6 or 7 years. There's commercials on TV all the time about low testosterone. There's testosterone boosters, supplements. I think the topic has gotten out there to the point where people are interested, but they maybe are scared or confused about testosterone, the therapies, whether it's real or not, and whether or not they should be buying some of these supplements and vitamins that are out and available on the market. As I said, I've been doing testosterone replacement therapy for men for 11 years now, so I have a fair amount of expertise in the topic and the subject, also in treating testosterone. But as we start, why don't we just talk about the symptoms of low testosterone? As we get older and our testosterone levels get lower, energy decline is one of the main issues. Now, what I've seen is these symptoms of low testosterone don't happen all at once. There is a misspelling on this slide. I apologize. I'm going to leave it there and just keep going. It is not testosterone. It is testosterone. Regardless, low energy. As we get older, the levels of energy start to decline over time. And as they decline, what happens is you may not notice it year over year, but at some point you cross what we call a symptom threshold. It means all of a sudden it's noticeable. So whether it's low energy, low difficulty with sexual performance, difficulty with having sexual libido, whether it is your mood, your ability to concentrate at work, your memory, ambition, focus, drive, your stamina for getting things done. All of those things start to decline with testosterone. But since testosterone starts to decline around the age of 30 by 1 to 3% per year, it may not be till you're in your late 30s, 40s, 50s, sometimes even 60s, where the testosterone has gone low enough in your body that you definitely notice that you just didn't feel the same way a year or two ago, and but your body has changed. You're working out, you're not getting the same muscle development and growth that you may have had in the past. You are having difficulty losing midsection weight. You're not recovering from your exercise as well as you used to. Your libido isn't as good as it used to be. Ironically, most people think of testosterone and aggression and anger and rage and mood and being crabby that way. But it turns out what I found is a lot of men with low testosterone are just feeling so bad, so poor, that their mood is depressed enough that they are actually crabby and not as friendly to be around. And when they get the testosterone levels corrected, people around them notice that they're just in better moods. So those are some of the symptoms of low testosterone. The benefits of testosterone are that you're going to have decreased mortality is one. That's a big one for me. There's some studies that have come out. One of them is from the VA. It's a smaller study, but it's still neat. They took half the men and put them on testosterone, and the other half they put on a placebo. And they looked in 5 years how those patients had done. And it turned out the half of people who had testosterone, who had the placebo, so the 50% of people had placebo, had a 20% all-cause mortality, meaning they died from whatever causes. They could be cancer, it could be cardiovascular disease, diabetes, old age, whatever. The other half, the treatment group, had a 10% mortality. So 20% versus 10%. Now, if I told you I had a pill that you could take that would reduce your chance of dying by half, would you take it? I mean, most people would say, yeah, right? But we're always concerned about, the risks of testosterone that people talk about, and I'll cover those. But it turns out that the risk that most people think about, which is prostate cancer, it turns out that it's actually the incidence of prostate cancer is lower in men who have the highest levels of testosterone. So the higher your levels of testosterone, the lower chance of finding prostate cancer. It kind of makes sense. I mean, you would think that if testosterone caused prostate cancer, you'd have cancer presenting when you were younger, not when you're older, when the testosterone levels are going down. But it's exactly what has been found. There's some great studies around that. Dr. Abraham Morgentaler out of Harvard has probably done the most studies and the most research. He's published in the New England Journal of Medicine, where he had found this. He's a urologist who found all these correlations that we thought were true way back from 1941. And here it is 75 years later, but people still have this misconception of testosterone causing prostate cancer. That's just not the case. It's safe. The other benefit of testosterone is you decrease your cardiovascular risk. There's studies that show congestive heart failure is lower, risk of diabetes is lower, metabolic syndrome is lower. And it kind of makes sense. I mean, if you're maintaining more muscle mass and you're more active and you're able to work out better, your body fat's going to go down. Your body fat goes down, your inflammation goes down, your risk factors for cardiovascular disease go down. So, if you really think about it, bringing your levels down to bring your testosterone levels to where they're optimized and they're healthy, and you're able to maintain muscle mass and get better workouts, you're going to have an improved lifestyle and decreased risk of decreased cardiovascular disease and diabetes. So let's talk about some of the causes of low testosterone. So the first one is just going to be age. As we get older, testosterone starts to go down. And as I kind of said earlier, let's just say you're 20 here, 30, 40, 50. I don't mind telling you that's where I'm at. I'm at the 50 mark already. Can't believe it. So I'm a child of the 80s. Let's say your testosterone levels are here. So you're going to have pretty good testosterone levels when you're young. But as you start getting older, they start to go down, like I said, 1 to 3% per year. Let's just make it fairly even as the decline. I think it goes a little faster as you get older. But remember I talked to you guys about this idea of a symptom threshold. So that number where you cross the symptom threshold is where you really start feeling the effects of low T. Even though they may be suboptimal here, you really start feeling the symptoms there. Now that could happen at any age. So that could happen over here, where you're just in your early 40s and the symptoms of testosterone have presented themselves. For me, it was right about here, right around 38 or 37, 39, where I had struggled with getting back in shape after I worked on Wall Street for a little bit. I was working out hard, working with a trainer, eating right, doing all the right things, but I just wasn't losing the weight. I was not getting the muscle. I wasn't really getting the body I should have gotten for the amount of effort I was putting in. So for me, that level happened a little early. I have patients who come in, they're 60, and that's when they start having the issues. I think my youngest patient somewhere in the early 30s around low T. Um, just as a real quick point, I mean, when somebody's thinking about testosterone therapy, there's different kinds of testosterone therapy, but if you're young and still looking to have children, you definitely want to preserve your ability to have children. The nice thing is you can have testosterone therapy and still be able to have a child, which I started on testosterone therapy, and I have a beautiful 11-year-old that I was able to have, even though I had started testosterone. So not only for my patients, but even for myself, that's been the case. So we talked about age as one of the key factors. What's interesting is we're starting to find people even younger who are starting to have issues with testosterone. And we know that over the years, over the last 40 or 50 years, sperm counts have been going down worldwide. Testosterone levels have been going down worldwide. And, this has been causing, like, where's this coming from, right? Like, I mean, if our parents or our grandparents were having higher testosterone levels than we're having, what is the cause? And we know that there's endocrine disrupting agents out there. And so that's one of the things. The environment is a big issue. I think, when we think about the plastics that we eat, birth control pills that are flushed down the toilet, antibiotics, maybe GMO type foods. But something's changed in our environment where it's affecting fertility rates. That's the word I was looking for earlier. So besides just the sperm counts going down and the fertility going down, if I just type in like environmental causes of low testosterone, so we can see that there's here, this first link is talking about endocrine disruptors in plastics, foods and personal care products. Here's an article from the UK. This is from 2018. Let's just see this. Testosterone levels are determined by the environment. So they're saying here the childhood environment rather than genetics or ethnicity is a major issue here. And so we can go into this and you can look into what the issues are. But the other one is lifestyle. So there's the things you can't change. I mean, the environment's the environment. Obviously, we could start to use glass containers, steel containers, avoid plastics as much as we can. We know fast food, unfortunately, has polysorbates in it. So McDonald's type burgers have polysorbates that might be affecting your endocrine systems. So we can try to reduce those. But there's also lifestyle issues. I didn't type that in, but alcohol, stress causes infections. Not working out, sleeping. So those are all issues that can lead to low testosterone. In my practice, what we've determined is, look, we can control the lifestyle. We can start working out better. We can improve the quality of our food. We can stop smoking. We can lose weight. All of those things are going to have some improvement in testosterone. But when we're battling environment and age, well, those are two things that are pretty hard to battle. We can do our best. Everyone's going to get older. And no matter how much you try to escape environmental issues, they're still going to be present. So what we can do, though, is do an assessment. We can, think about what the symptoms of low T are, and we can order labs and then decide if we need testosterone replacement therapy, right? So symptom analysis wise, actually I'm going to go back to Google here because there's an assessment. You could do what's called a low testosterone questionnaire. It's called the Atom questionnaire. And I'm doing this because I want everyone to be able to know that they can take charge of their own health. If you have the question and you know how to look for it on Google, and then you also have to be question, you have to look at your results and make sure you believe the results of the Google search, of course. But if I do the low testosterone questionnaire, so these guys have this Adam questionnaire uploaded, and the questions are pretty simple. Do you have a decrease in low libido? Do you have a lack of energy? Do you have a decrease in strength or endurance? Have you lost height? Everyone loses height as they get older, so that's kind of an automatic yes. Do you have noticed a decrease in enjoyment of life? Are you sad or grumpy? Erections less strong? Recent deterioration in your ability to play sports? Falling asleep after dinner? There's actually multiple causes of that. Or has been deterioration in your work performance. So this is, if you've answered yes to more than 3 questions, or it's number 1 and 7 that you answer yes to, then you probably have low testosterone. That's just a questionnaire if you want to do something ahead of going in to get your labs checked. But look, laboratory testing is where it's going to be. So let's cover that a little bit. So when I check for testosterone levels, the labs I'm looking at are going to be total testosterone, and free testosterone. Now, often at a clinic, they're just going to be checking the total testosterone. And the total testosterone I find to be less useful. The last and I'll tell you why here in a minute. The last piece is the true testosterone, is what's called the bioavailable testosterone. Okay. So total testosterone is sort of like all the testosterone in your body, but most of that testosterone is bound up onto proteins like albumin, or another protein called steroid hormone binding globulin, or SHBG. Okay. About half of the testosterone is over here. Once it's bound to the steroid hormone binding globulin, it really doesn't come off. So it adds to the total testosterone, but it's really not that available. So if you take that total, let's just, for example, say the testosterone was 1,000. Already what's available is at least only a minimum at 500 at most. And that's if nothing was bound to albumin. And we just think of another way of thinking about this is, think about how much you have in assets and what you really have that's available if you want to buy lunch today. So if you have a house that's worth, let's say, $200,000, that's great if your asset's worth $200,000. But if you only have $10 in your pocket, you're not going to be eating steak that day, right? You're going to have like whatever you can get for $10, and it's probably not going to be a fancy steak dinner. So that's what the free testosterone and bioavailable testosterone are. They're going to be what's available. So half of it's bound over here to the steroid hormone binding globulin. The other half is on albumin, which about 1 to 3% of that will turn into free testosterone. We'll turn over here, right? So free testosterone is going to be let me rephrase that. The free testosterone circulating around, 1 to 3% goes into the bioavailable testosterone. So 1 to 3% of what comes off of albumin plus the testosterone off the albumin equals your bioavailable. Okay, that was a little kludgy. This is a number that's a little harder to get. You can order it, but the take-home point here is, for me, I always look at the free testosterone level. I always order that test because that's going to be close to the bioavailable. What we're missing is that 1 to 3%. So I know what's in my pocket of money that I can use to go buy lunch. It's a little higher because you've got the 1 to 3%. So let's say that $10 is really like $12. but it's around the ballpark. It's very different than the $1,000. Hopefully that makes sense, even though I kind of klooched through that, but I wanted to make sure you understood again the difference between total, which is what most places are going to order. It's not enough data, in my opinion. You want to get the free testosterone. That's easy to get. Some labs you can still get the bioavailable. That's a little bit more accurate, but I don't think it's necessary to get that. So I usually just focus on the free testosterone. Okay, so knowing that if you're replacing testosterone, there's many ways to do it, and we're going to cover that in another webinar. But injectable testosterone is the way I go. There's different forms of injectable testosterone. I have my favorite. I'll cover that. But there's also testosterone pellets. There's testosterone creams. Like I said, there are those testosterone booster pills you can take. We haven't found much success with that in our practice. Having said that, if you think you wanted to try something like that again, I would test first and see what these numbers look like. Take the supplement and then see how much it improved. With that said, I think that covers what I want to cover from an educational standpoint for this webinar. Angela, I'm going to see if you could check in the chat for anyone who has questions around what we discussed here.
Dr. Patel, we do have a question regarding females with low testosterone. Someone wanted to know if the symptoms are the same for low testosterone in a woman.
Yeah, the symptoms are similar. I'm going to have a whole webinar around females and testosterone, but I will tell you this. Hormone replacement therapy is essential for women. We've been doing hormone replacement therapy in women for 50, 60 years now. There's some studies that came out in the late 90s, early 2000s that kind of ruined hormone replacement therapy for women for a while. But what we're finding now, though, is women have to have hormone replacement therapy, and one of those hormones is testosterone. Now, the levels of testosterone for women are a lot lower than they are for men, so the effects aren't as pronounced. And you also have to think about estrogen and progesterone, and that balance for women is the most important piece. But one thing most women don't realize is women actually have a little bit more testosterone in their body than they even do estrogen. So as those testosterone levels go down for women, along with estrogen and progesterone with age, replacing all of those are essential for vitality, health, and energy for women, and maintaining muscle mass and keeping body fat off.
Dr. Patel, we have another question. It's a two-part question. One is, does replacement therapy kill your natural production of testosterone? And two, what happens if you do go off the TRT?
Yeah, those are great questions. That's probably should be part of my just the way I presented it in the first place, but those are important. So testosterone levels, when we take exogenous testosterone, meaning it's coming from outside the body, that is going to tell the body's going to read that testosterone and say, I do have enough testosterone, and you are going to produce a little bit less testosterone. And so how much testosterone you're taking, the dosing, the frequency, all of that does have an impact on your own natural production. We don't do levels of testosterone that are so high that we're completely suppressing the natural production of testosterone. Now, there are other ways to improve your body's natural production, even while you're on testosterone, whether that's taking other medicine like a fertility drug like clomiphene can help stimulate the body's natural production of testosterone. Some people do that just for to get their testosterone levels up instead of taking testosterone. But yeah, your natural production goes down, but it never shuts off completely. And then to answer the second part of that question is when people have gone off of therapy, their testosterone levels come back to about what they were at when they started. So, but you got to remember, if you're low on testosterone and your body was at this level of performance, and we take the testosterone, oh my God, I've got a call coming in. Let me stop that. We take the testosterone and your body's performance goes up to here. Now, when we get off of the testosterone, you're just at a much higher baseline. And even though you are going to suffer the symptoms of low T and the muscle mass, your body's better from having taken it than never have taken it. Um, but getting off of testosterone after about 4 to 6 weeks, you'll be back to what your production was before you had started. There's ways to kickstart that again with clomiphene or human chorionic gonadotropin if we need to. But generally speaking, most people who are on testosterone, if they can stay on testosterone, will want to continue taking it. Let's see, I think we probably have time for another question if we have one.
We do. Someone asked if your doctor doesn't order the free testosterone test, is that something you can order on your own, or do you have to have a doctor supervise that?
Yeah, that's a great question. So we talked about this in another webinar about how you can order your own labs. So if we were just kind of going back to one way of doing it is ordering own labs, order my own labs. So again, Quest is one of these. Let's just try this one today. No doctor's visit required. You can come in here and look for a testosterone test here. Here's one here. There's Men's Health. Oops. And testosterone is going to be in here. And the free testosterone's right here. So there's a free testosterone. And here's the bioavailable. So again, I get enough information with a $59 free testosterone test, but the bioavailable is $109. So I guess that's, it's doable if you wanted to get it. Now there's other labs that order in a whole testosterone panel, by the way. It's not just testosterone. It's going to be the total free testosterone. I'm looking at the estrogen. I'm looking at hemoglobin, hematocrit. That's for another webinar where I'll go into more detail around all the hormones you should be checking. But if your doctor doesn't order it, you could do it yourself. You could probably type in Low T Clinic, Low T Center. Let's see, Low T Clinic. I'll just try to find something generic here. Obviously, these people are going to be testing testosterone as well. So if your doctor's not doing it, but you're interested, you could just type in Low T Center and see what's around you. They're obviously going to check the testosterone. I think the testing that they're going to offer is limited compared to what I would do in my practice, but it's certainly a way to start getting an assessment. I think the treatment protocols are probably a little tighter about whether or not they would treat it. So I would say you could look at functional medicine doctors. That's always a good thing to consider. So functional medicine doctors, low T clinics, or just ordering the labs yourself would be the way to do it. All right, guys, that's what we have time for today. But I'm hopefully able to have taught you something about testosterone, answer some questions about why testosterone is important in your body, and safe ways to get it up. If you have any questions, just go to the website, www.BhaveshMD.com. We'll have this webinar posted, and we'll have a place for you to reach out to us, whether it's through a phone call like you'd like to schedule, or if you just have questions that you want to email us or put it into the comment section. We'll try to answer any additional questions you guys have. Have a wonderful day, and we'll look forward to seeing you on the next webinar. Bye.